what extent do transthyretin levels specifically reflect the progression of hereditary transthyretin-mediated amyloidosis with polyneuropathy as opposed to the other neurological or systemic condition?
Okay, in ATTR amyloidosis, we know that the pathogenic process starts with the transthyretin that dissociates into its monomers and forms the amyloid fibrils that will cause organ lesion and the clinical manifestations, but namely, for example, polyneuropathy or myocardiopathy. The transthyretin, since it's part of the pathogenic process, it makes sense that might be a good biomarker in this disease. Of course, also TTR is also influenced by other factors. For example, inflammatory disease, severe malnutrition. So it's not it can be variable for patient in considering the comorbidities. So we have to take that in account before interpreting TTR as a biomarker.
And in your opinion, what are the other main strengths and limitations of using transthyretin as a biomarker to guide therapeutic decision-making in patients?
So I have already described some limitation of this biomarker. We also we don't have already any clinical data to say that it's useful to try to monitor response to treatment and to decide if we have to switch therapy or not. We know that the current therapies might influence TTR levels, and maybe we can, depending on the TTR level, we can predict if the patient is responding or not to treatment, but we don't have any data regarding this, so we need further studies to confirm the role of TTR as a biomarker in this setting.
Which future studies or techniques do you consider most promising to improve the accuracy and reliability of disease monitoring through biomarkers such as transthyretin?
In case of transthyretin, it can be a useful biomarker because it's easily tested in the serum. The problem is the laboratory test that is used, and we are not sure if it's only measuring the tetramer or also the monomers. We're not sure about that. So we have to find a more specific laboratory test and standardized in different centers, and to be sure that we can use TTR as a biomarker for ATTR variant amyloidosis.